Artificial Intelligence Doctor. User question. What are the physiological mechanisms behind increased lung pressure and decreased lung capacity when lying on your back? GPT-01 answer. When lying on your back, a position known as the supine position, several physiological changes occur that lead to increased lung pressure and decreased lung capacity. These changes are primarily due to the effects of gravity on the body structures, alterations in the mechanics of breathing, and shifts in the distribution of ventilation and blood flow within the lungs. Below is a detailed explanation of the mechanisms behind these phenomena. 1. Effect of gravity on the diaphragm and abdominal organs. Upward pressure on the diaphragm. In the supine position, gravity causes the abdominal contents, such as the liver, stomach, and intestines, to shift upward toward the thoracic cavity. This upward movement exerts pressure on the underside of the diaphragm, the primary muscle responsible for inhalation. Restricted diaphragmatic movement. The increased pressure on the diaphragm limits its ability to contract and move downward during inhalation. This restriction reduces the expansion of the thoracic cavity, leading to decreased lung volumes, particularly the inspiratory capacity. 2. Compression of the lungs by the chest wall and mediastinal structures. Weight of the chest wall. When lying on your back, the weight of the anterior chest wall presses down on the lungs. This added pressure increases the intrapulmonary pressure within the lung alveoli, making it more difficult for the lungs to expand during inhalation. Mediastinal shift. The heart and major blood vessels in the mediastinum can exert pressure on adjacent lung tissue in the supine position, further reducing lung expansion. 3. Decreased functional residual capacity, FRC. Reduction in lung volumes. Functional residual capacity, the volume of air remaining in the lungs after a normal exhalation, is significantly reduced when lying down. This decrease is due to the combined effects of diaphragmatic elevation and chest wall compression. Closure of small airways. A lower FRC can lead to the closure of small airways, especially in the dependent, posterior regions of the lungs. This results in reduced ventilation to these areas and can contribute to hypoventilation. 4. Altered intrapleural pressure gradient. Less negative intrapleural pressure. The intrapleural pressure within the pleural cavity, becomes less negative in the posterior regions of the lungs when lying supine. This change reduces the transpulmonary pressure gradient, the difference between alveolar and intrapleural pressure, making it harder for the lungs to expand. Redistribution of ventilation. Ventilation tends to shift toward the anterior, non-dependent regions of the lungs, leading to uneven air distribution and potentially less efficient gas exchange. 5. Increased airway resistance. Narrowing of airways. The gravitational effects and mechanical compression can cause a slight narrowing of the airways, increasing airway resistance. Work of breathing. With increased resistance and decreased compliance, the respiratory muscles must work harder to achieve adequate ventilation, leading to an increased work of breathing. 6. Ventilation perfusion, V/Q, mismatch. Altered blood flow distribution. Blood flow in the lungs is also affected by gravity. In the supine position, blood flow becomes more evenly distributed, but ventilation is not, leading to mismatches in some areas. Impaired gas exchange. V/Q mismatch can result in less efficient oxygen uptake and carbon dioxide removal, contributing to feelings of breathlessness or decreased exercise tolerance when lying down. 7. Reduced lung compliance. Stiffening of lung tissue. The combined effects of external compression and internal pressure changes can decrease lung compliance, the ability of the lung tissue to stretch and expand, further limiting lung capacity. In summary, lying on your back increases lung pressure and decreases lung capacity due to gravitational forces causing upward displacement of the abdominal organs against the diaphragm, compression of the lungs by the chest wall and mediastinal structures, decreased functional residual capacity leading to airway closure, altered intrapleural pressures reducing lung expansion, increased airway resistance, and ventilation perfusion mismatches, impairing efficient gas exchange. These physiological mechanisms collectively contribute to the observed changes in respiratory function when transitioning from an upright to a supine position.